You have been tired for months. Not the tired that sleep fixes, the tired that is still there when you wake up. And everyone around you has a simple explanation. You're in your 60s. This is just aging. But here is what I need you to hear before you accept that answer. Persistent fatigue in older adults is one of the most overlooked signs of early kidney stress, and most people miss it for years because it does not look dramatic. It just looks like getting old. Today, I am going to walk you through 5 specific patterns of fatigue that may be telling you something your last checkup missed. Not 5 random symptoms, 5 combinations. Because what comes with the tiredness is what matters most. Pay close attention to the 4th one. It is the most commonly dismissed, and the one most worth catching early. I'm Grace Wells, kidney and diabetes health educator for older adults. Let's get into it. Before we talk about the 5 signs, I need to explain something that most people have never been told about their kidneys and energy. Your kidneys do a lot more than filter waste. Among their many jobs, they help signal your body to produce red blood cells. They do this through a hormone called EPO, erythropoietin. Most people have never heard of it. When the kidneys are under stress or functioning below their best, EPO production can drop. And when EPO drops, red blood cell production slows. Fewer red blood cells means less oxygen reaching your muscles, your brain, your heart. And what does low oxygen feel like? Exhaustion, heavy legs, foggy thinking, the kind of tired that sleep does not fix. This is called anemia of chronic kidney disease, and it is far more common in adults over 60 than most people realize. It does not always show up with dramatic symptoms. It can look exactly like what everyone around you has been calling just aging. This is why knowing the pattern matters. So let's talk about the 5. The first pattern is fatigue combined with swelling. Not the swelling you get from standing on your feet all day. This is different. It tends to show up in the ankles and feet in the evening. Sometimes around the eyes in the morning, a puffiness that fades as the day goes on. Sometimes in the hands, where rings start to feel tighter than they used to. When the kidneys are not filtering as efficiently as they should, fluid can accumulate in the body's tissues. The kidneys are responsible for maintaining the right fluid balance. When that balance shifts, the body holds onto water it should be releasing. Now, swelling alone can come from many things: heart issues, certain medications, low protein, long periods of sitting. But when you are also consistently exhausted, not occasionally tired, but chronically drained, and you are also noticing this fluid retention, that combination deserves a closer look. Ask yourself, do your ankles look different by evening than they did in the morning? Are your shoes fitting differently than they did a year ago? Do you feel heavier than your weight would suggest? These are not questions to dismiss. These are questions to bring to your next doctor's appointment with specific language. Tell them both things, the fatigue and the swelling, together. Because separately, each one might get explained away. Together, they paint a different picture. If this is making you think of something you have been noticing in your own body, that is exactly why I make these videos. The second pattern is fatigue combined with breathlessness. This one surprises people because they do not think of the kidneys when they feel winded going up the stairs. They think of the heart, they think of the lungs, and yes, those should absolutely be checked. But the kidneys are part of this picture too, and here is why. Remember the anemia connection we talked about earlier. When red blood cell counts drop, which can happen with declining kidney function, your body has to work harder to move oxygen around. The heart beats faster. Breathing becomes more effortful. Simple tasks that used to feel easy now require more breath. Climbing stairs, carrying groceries, getting dressed in the morning, walking to the car. For some seniors, this is so gradual that they stop noticing it as a symptom. They just start doing less. They stop taking the stairs without really deciding to. They sit down more. They participate less. And the people around them say, well, they're getting older. But breathlessness with fatigue, especially if it is new or getting worse over months, is not something to accept quietly. It is something to investigate. There is also a kidney-related issue called metabolic acidosis, where the blood becomes too acidic when the kidneys are not removing enough acid from the body. This can make breathing feel like more work, and it can contribute heavily to exhaustion. It is measurable with a simple blood test. Most seniors have never heard of it. Your doctor can check this. You just have to ask. The third pattern is fatigue combined with changes in urination. This is the one people feel embarrassed to mention at a doctor's visit. They assume it is just a bladder thing, or a prostate thing for men, or simply age. But the kidneys and the urinary system are deeply connected, and changes in urine can be one of the earliest and most reliable signs that something has shifted in kidney function. What kinds of changes are worth noticing? Going to the bathroom more often at night than you used to. Waking up 2, 3, 4 times is not a normal baseline for everyone. For some people, it is new. And disrupted sleep means poor quality rest, which compounds the fatigue in a very direct way. Urine that looks foamy or bubbly. This can indicate protein in the urine, something the kidneys should be keeping inside the body. When the filters are damaged, protein leaks through. Foamy urine is not something to wait on. Urine that is unusually dark or unusually pale. Changes in color can reflect how concentrated the urine is, which tells you something about how the kidneys are managing fluid. Less urine than usual, combined with swelling and fatigue. That combination in particular is worth a call to your doctor sooner rather than later. None of this is about diagnosing yourself. It is about paying attention to what your body is doing and using that information when you talk to your doctor. Bring a note if you have to. Write it down. I have been more fatigued than usual, and I have noticed my urine has been foamy several times this week. That sentence alone could change what your doctor orders at your next visit. We are halfway through, and I want to pause for a moment and say something important. None of what I am describing today means panic. It means pay attention. These signs do not confirm kidney disease. They do not confirm anything by themselves. What they do is give you a reason to ask a specific set of questions, and to push for the right tests if your concerns have been dismissed. The most important thing I can offer you today is not a diagnosis, it is language. Language you can take into a 10-minute appointment and use clearly, specifically, and confidently. Keep that in mind as we continue. The fourth pattern, the one I asked you to stay for, is fatigue combined with loss of appetite or nausea. This is the one most seniors explain away as a stomach issue. Acid reflux, something they ate. Stress, getting older. But when the kidneys are not effectively removing waste products from the blood, those toxins begin to accumulate. This is called uremia, though it does not have to be severe to cause symptoms. Even mildly elevated waste levels in the blood can affect digestion, appetite, and how food tastes and smells. Some seniors describe food starting to taste metallic. Others say they just have no interest in eating the way they used to. Some feel mildly nauseated in the mornings. Some feel full very quickly, even with small amounts of food. And when appetite drops and eating becomes irregular, energy drops further. It is a cycle. The kidney issue reduces appetite, the poor nutrition worsens the fatigue, and the fatigue is blamed entirely on aging or depression or just getting old. This is why this pattern of all 5 tends to go unrecognized the longest. If you or someone you care for has been fatigued and eating less than usual, or mentioning that food just does not appeal the way it once did, especially if this has been going on for more than a few weeks, please mention both of those things together at the next doctor's visit. Not just one, both. The combination is what opens the right door. The 5th pattern is fatigue paired with existing high blood pressure or diabetes. This one is different from the others, not because it involves a new symptom, but because of what already being diagnosed with these conditions means for your kidneys. Diabetes and high blood pressure are the two leading causes of chronic kidney disease in older adults. Not uncommon causes, the leading causes. If you have lived with either of these conditions for a number of years, your kidneys have been under pressure for a long time, even if your numbers have been reasonably controlled. And one of the most telling signs that kidney function may be declining in someone with diabetes or hypertension is increasing fatigue. Not fatigue from a bad night's sleep, fatigue that is steady, fatigue that does not have an obvious cause, fatigue that your doctor may not be linking to your kidneys because no one has ordered the right test yet. For seniors managing diabetes, there is also the very real factor of blood sugar fluctuations affecting energy. High blood sugar causes fatigue. Low blood sugar causes fatigue. Poorly managed blood sugar over time contributes to kidney stress, which can eventually lead to the anemia we discussed earlier, which causes fatigue. It can become a loop that is hard to untangle without the right information. If you have been diagnosed with diabetes or high blood pressure and you have been more tired than usual, not occasionally, but consistently, this is worth bringing up specifically in terms of your kidneys. Ask your doctor, could my fatigue be connected to my kidney function? That question alone may prompt a different type of follow-up. Now let's talk about what actually gets tested and what to ask for. When fatigue is the main complaint, a standard checkup sometimes does not go deep enough. Your doctor may run basic blood work and say everything looks normal. But normal depends on what was actually tested. Here are the tests that are most relevant to the kind of fatigue we have been discussing today. A CBC, a complete blood count, checks for anemia. This is where low red blood cells would show up, which could explain persistent exhaustion. This is usually part of standard blood work, but it is worth confirming. Kidney function tests, including creatinine and eGFR, measure how well your kidneys are actually filtering. eGFR is the estimated glomerular filtration rate, and it gives your doctor a percentage of how your kidneys are performing. Many seniors have never been told their eGFR number, even when it has been tested. Urine albumin, also called a urine microalbumin test, checks whether protein is leaking into the urine. This is one of the earliest detectable signs of kidney stress, and it is often not included in routine blood panels. You may have to ask for it specifically. Iron and B12 levels are also worth checking because deficiencies in both can cause significant fatigue and are very common in adults over 60 and can exist alongside kidney-related anemia. Thyroid function should be tested if it has not been checked recently. An underactive thyroid can cause profound fatigue and is common in older adults. A medication review is something many seniors do not think to request, but absolutely should. Many commonly prescribed medications, including some blood pressure medications, diuretics, pain medications, and even certain supplements, can contribute to fatigue. Sometimes the tiredness is a side effect that can be addressed simply by reviewing the medication list with your doctor or pharmacist. And finally, metabolic panel results, specifically looking at electrolytes and bicarbonate, can indicate whether metabolic acidosis is present, which we mentioned earlier as a kidney-related contributor to breathlessness and fatigue. You do not need to ask for all of these in one visit. But if your fatigue has been dismissed as just aging and none of these have been checked recently, this list gives you a starting point for a real conversation. Your comment may help another senior who has been in the same situation realize they are not alone in feeling dismissed. If you have had to push to get the right tests, let others know in the comments below. That shared experience matters more than you might think. Before we close, I want to take a moment to address something that may be sitting in the back of your mind. What if you do have some of these patterns? The fatigue, the swelling, the breathlessness, the appetite changes, and you have been avoiding the doctor because you are afraid of what they might find? That fear is completely understandable, and it is also the thing that allows a manageable problem to become a larger one. Kidney disease, when caught early, is something that can be slowed significantly with the right medical management. That might mean medication adjustments, dietary changes specific to your lab results and your kidney stage, better blood pressure control, closer monitoring of blood sugar. It rarely means anything dramatic at early stages. What it always means is, the earlier you know, the more options you have. That is not a slogan. It is how kidney disease actually works. The window for doing the most good is open longer than most people assume, but it does not stay open forever. So if something in this video has made you recognize a pattern you have been ignoring, I want to gently encourage you to make that appointment. Not with fear, with information. Here is what I would like you to take from today. If your fatigue comes with swelling, with breathlessness, with changes in urination, with nausea or lost appetite, or if you already live with diabetes or high blood pressure, these combinations are worth a specific conversation with your doctor. Write down what you have been experiencing. Use the language we talked about today. Ask about your eGFR. Ask whether a urine albumin test has been done. Ask about your CBC and iron levels. Ask for a medication review if fatigue has been ongoing. You are not overreacting. You are advocating for yourself. And that is exactly what this information is here to help you do. One more thing before we close. A note I want to be clear about. Everything I have shared today is educational, it is not a diagnosis, and it is not personal medical advice. Kidney function, nutritional needs, fluid intake, and medication effects all vary based on your individual health history and lab results. Please work with your own doctor or healthcare provider before making changes to your diet, medications, or routine. Especially if you have been diagnosed with kidney disease, diabetes, heart disease, or high blood pressure. Now, I have a question for you, and I genuinely want to hear your answer. Is your fatigue worse in the morning when you first wake up, or does it tend to hit later in the day? Leave your answer in the comments, not because I am collecting data, but because when someone else reads your answer, they may realize for the first time that they are not the only one. That is what a community like this can do. And if this is the kind of kidney and diabetes health guidance you have been looking for, clear, honest, and actually relevant to your life at this stage, then you may want to stay connected to this channel, because there is more to cover, and I will keep making it as useful as I possibly can. Take good care of yourself this week.